Hey everyone, it's Drew here back with IM3 at FFAS 2018. I am joined by Dr. Bunin. Thanks for joining us.
Oh, thank you.
So you had a presentation on neuromodulators. You want to talk about that a little bit?
Sure. Today I gave a presentation on the pearls and pitfalls of using neuromodulators. There are 3 different neuromodulators that are commonly used now. There's Botox, Dysport, and Xeomin. They all have a little different onset, a couple of different things to it, but it's really about choosing what to use where and how to do it. Same thing as what I've presented on fillers. It's where do you use it, what works the best. So in this case, there are danger zones, and a lot of the things for me as an oculoplastic surgeon, one of the things that people are always coming to me about are things with their forehead, and they don't like these lines between the brows.
Right.
Squint for me, let's say crunch. Oh yeah, so you have those nice lines there. Well, the problem is that if you just do this part,
Right.
and you try to go across here, many times people have asymmetries, and you have to be aware that the eyebrow is the curtain rod,
Okay.
and the eyelid is the curtain. So people lift their brows
Interesting.
sometimes because their lids are droopy, and people
Okay.
don't realize that.
Okay.
So you really have to look at each person and know the anatomy, and it shouldn't be cookie cutter. The other thing that was very interesting is when you use larger doses, we're finding that it lasts longer than the 3 months. And so a lot of people do the very, very low dose, but then it works only for 2 to 3 months.
Right.
And if you use a little higher dose, we've been getting longer lasting in
Okay.
areas.
So talk to me a little bit about the approach. There's so many neuromodulators, fillers out in the market. Talk to me about the approach of which ones you use for which patients, or, is there different situations or?
Oh my goodness, that's a long question.
I know,
There's so
right?
many things involved. When it comes to the neuromodulators, they are not super different in terms of that they all do the same thing of relaxing the muscle.
Okay.
And so when you relax the muscle, so I like to explain, so you have wrinkles at rest, like look at my material, but when I move and I get more wrinkles, those wrinkles of movement, that's what neuromodulators work on. And so I'm not changing this material, I'm not changing the volume. All I'm doing there is relaxing so that the creases don't form when the muscle moves.
Gotcha. Okay, that's a
Okay.
great analogy.
Versus filler. Now, filler is totally different. Filler is used to reinflate. So if you think about a balloon, like a hot air balloon with all those pretty colors on the outside, that's the material. As it loses volume and deflates, you get wrinkling. So that wrinkling is from deflation, then the neuromodulator is not going to work on that because it's not a muscle issue.
Okay.
So if you instead reinflate, you can make a person look younger and more rested, and in 3 dimensions. We always, when we look in a mirror,
Yeah.
we look straight ahead, and we don't really realize that a lot of times it's the 3/4 view.
Sure,
the nice
sure.
curve of the cheek, the way the brow is up higher. As we lose volume, we're losing volume in fat, muscle, but people didn't even realize we're losing volume in bone.
Oh,
and so the
wow.
bone is shrinking underneath. Our orbit gets bigger.
Okay.
Our cheekbone gets smaller. Our jawline gets smaller. I think people are used to that when they have dental surgery. It seems like the mouth shrinks and they kind of get that Popeye look. Like
Yeah.
dentists are in. That bone loss people kind of know about.
Okay.
But the rest that happens in the face is also bony deflation.
Yeah, I had no idea.
So what filler do you use where depends on where the volume loss is and whether you want a thicker or a thinner filler, one that's got more lifting capacity. And you can place the same filler in a different part of the face and get it lasting a different amount
Okay.
because it has to do with how quickly the body breaks it down.
Okay.
There are natural substances in these fillers. They're things that we wouldn't be allergic to.
Okay.
Hyaluronic acids are the clear gel ones, and we use them for almost anything.
Right.
We can, and if I want to reshape the face, I might use a stronger filler. If I want to give you more of a cheekbone, or if I want to smooth out the top of the nose,
Yeah.
I would use a different filler than I would to fill in the bags underneath, the
Okay.
hollows underneath the eyes.
Right,
the clear gel.
right.
So there's not a cookbook.
Okay.
And we are finding more and more, and that's what I love about being at this meeting.
Yeah.
Where all of us are highly trained and credentialed medical professionals. So we know the anatomy, we know where we're putting it, so we are better able to say, okay, so to replace this fat pad, I'm going to use this, and then I'm going to use a little neuromodulator to release these lines, and I'm going to put you on a little skincare or do a laser for this dyschromias that you have. It's all about knowing what to do where you are.
Okay. Cool. All right, last question then. So you touched a little bit about the different kind of specialties that are represented here at this meeting. How important is it for you as a doctor to be working with, the facial plastics, the derms, and kind of seeing those different approaches together?
I think it's a wonderful way for anyone to continue their education, because sometimes we see things from just our perspective.
Sure.
And there's a lot of crossover, but there's a lot of things that might be different in another specialty. So this kind of multi-specialty meeting is an amazing thing. I have been doing this and teaching at these kinds of meetings for many years because I am an ophthalmologist and an oculoplastic surgeon.
Oh, interesting.
And I did a sub-internship in derm.
Okay.
So I've always had more of an interest, and it crosses over.
Yeah.
We can learn so much from each other.
Cool.
And it's things like this that bring us together
Yeah.
and make us better at being good for our patients.
Beautiful. Well, thanks for joining us. I really appreciate it.
Oh, it's a pleasure.
Have a good rest of your meeting.
Thank you so much.
You're welcome.